Welcome to USA Global TV and Radio, where our mission is to provide education, entertainment, hope, and inspiration. USA Global TV and Radio connects you with experts and audiences all around the world every single day to help you succeed in business and to live a richer life. Visit us at usaglobaltv.com to learn about career and life-changing training and mentoring programs like the Listening Mentor. Subscribe to our newsletter to stay informed about our special programs and offers. Discover how you can become a guest on one of our shows or a host or producer of a USA Global TV and Radio show of your very own. That's USA Global TV and Radio, where the doctor is always in.
Hi, red.olaughlin here, Talking Heads, and today is part 7 of 6. I originally started this thing out with cancer, its causes and options, thinking that I could do it into the standard 6-part program. And as we went through and started diving into some of the topics and getting to real meat of the issue is to say, what do we really need to know? What value can we put out there for the viewer, the listener? And it didn't have a life of its own, but there's just so much value there that I said, it doesn't make sense to finish it in 6 because there's just a lot of more information. So as I was wrapping up the last 2 portions of this, one of them being, what are the treatments that are used right now for cancer? We're going to go over that today. And then the last section, prevention. What makes sense based on what we know today? We talked about causes. We talked about a lot of things already. But 1 or 2 slides, I think we can probably wrap up the prevention end. But in the process of doing the treatments, everybody knows about radiation and chemo, but there's just a lot of stuff out there that people don't know. And I think it's important if you know somebody with cancer, if you have it, somebody in your family, this is an awareness program, education. Take this information and say, hey, your doctor, family physician, your oncologist, your surgeon, there may be things that might apply to you, but if you don't ask, you'll never know. And so that's what the whole purpose is to learn a little bit more what's causing cancer, what can we do about it, etc. So let me pull up my slide deck here so we can get started. And okay, as always, a disclaimer. I am a researcher. I'm not a medical doctor, not a pharmacist, never been in those fields, never operated there. I explore, I investigate, I examine. I look at the human body at the cellular level. I look for cause and effect relationships. What causes this to happen? What can you do to stop it? What can you do to slow it down? What can you do to speed it up? Those are the things I'm looking for. And if we have a symptom of something and all we're doing is treating the symptom, the cause is going to continue no matter what. So it's very important to treat a cause of a problem when you can, than not. Now, I love chemistry. It's one of those things. Probably have a couple words in here today that look weird, but it's important that if you want to be able to know something, go back into the archives, view the video, stop the slide where you need to be at, copy the word down, and take it with you or do it for the research. And sometimes when you're doing research, it just doesn't make sense, because if you're looking at something and they're going on down this, the whole problem with, you have to ask Google the right question, or YouTube. I find YouTube far more valuable for the kinds of information I'm trying to put out than Google, because you really have to be very explicit about the question you ask. If I say, tell me the causes of cancer, I'm going to get the standard. You're never going to get down into the nitty gritty. But if I say, talk to me about lactoferrin and cancer treatment, it's going to tell me everything I want to know, but it won't tell you at the beginning. Regardless, let's go on down the road here. Today, we're talking about treatment options and prevention. However, we're not going to get to prevention today. We're going to wrap up things that are right around 30, 31 minutes and then cover everything, finish up next week. Okay. Obviously, any kind of treatment, the earlier you start, the better it is. And that cancer is the same way. The biggest problem is, how do you know you don't have a disease? How do you know that you have any kind of disease? And if you only suspect it, well, it's kind of hard to figure it out. Uh, and if you have one disease, maybe there's another one that's being masked by it. If you knew you had something and you were able to isolate it in the body and you had the right kind of testing equipment, yes, you could probably catch things super early. But for most of us, that never happens because we don't know we have a problem. And then we start getting some symptoms, and many of us just ignore it. That's going to go away. And okay, after, if it doesn't go away in 2 weeks, talk to somebody. That's the big thing. You let it go a month, it's still there. There's probably something you really need to talk to somebody about. Uh, the immune system works well when it's highly tuned. However, a lot of us don't always keep our immune systems highly tuned. We have lifestyle choices, what we eat, our exercise, our stress management, our sleeping, lots and lots and lots of things there that we have choices over. And if we make the right choices, great. We'll keep most of the genes, the genetic issues at bay because we just never allow that gene to turn itself on, and we can go from there. But if we know we have a particular problem, let's say I have leukemia, it's a specific disease, I can probably get treatment for it. The earlier, the better. Uh, Sometimes there are treatments out there, but the FDA is not necessarily your friend. There's things that they are very good at, no doubt about it, but they're overly concerned it's safe, and they should. But there are things out there that, well, if we tested that and we know for sure that's going to work, like everybody, follow the money. Because if you don't open something, then there's a problem. But FDA, your doctor, they all have a legal, moral, real responsibility. If they find a problem with you, they need to treat it. And that's part of the problem is the FDA will only allow certain kinds of treatment. So let's continue on and see what we have here. Surgery, obviously a treatment that's used a lot of times. You remove the tumor, any surrounding areas around it. They'll come back later on, take a look at it in a microscope. It's called clearing the margins, the margin of what they took out to make sure there's good cells all the way around the entire piece they took out of you. Most of the time, a little over half, 60% of the time, that surgery is recommended. There's sometimes surgery cannot be done, but they might be able to treat it in such a way that 3 months from now they can come back and do surgery. So uh, there's 5 different stages. Stage 0, which almost nobody ever hears about because we never find it that early. It's there. They can detect it by some way, shape, or form. And okay, we know for sure you have cancer of the kidney or something, whatever it is. But it's so small, it's localized, it hasn't gone anywhere. Stage 1, it gets a little bit bigger, has not left the organ, hasn't gone to a lymph node. And they'll generally take a look at the lymph nodes as they're pulling out. Let's say they have this little tumor and they're pulling it out. They'll look at the lymph nodes that go off from that particular part of the body. And if there's nothing in those lymph nodes, then they say, okay, fine, you're stage 1, stage 2. But if you're starting to see it in lymph nodes, more than a couple, now we automatically upgrade it to stage 3, more serious, because that cancer is starting to grow elsewhere in the body. And then stage 4, the thing that nobody ever wants to hear about, now it's gone from the particular organ or tissue, wherever it's at, into other organs, into your bones, into your brain, into your lungs, whatever it may happen to be. You don't want to hear stage 4. Is it a death sentence? Well, depending on how it's treated. If we look at the conventional way of doing things here in the United States, if they treat it as a genetic disease, we'll talk about the survival rates as we go through, because not every single cancer has the exact same survival rate. However, if it's treated as a metabolic disease, I think the opportunities are much greater. But we'll cross that bridge here shortly. Okay. Survival rates with surgery, stage 0, 99%, literally 100%. Stage 1, why do I have, if I get it and it's localized and I can pull it all out, what's going on? Well, it's interesting that sometimes you have a cancer tumor that's there, and it is like an alien life form. It controls the body because it doesn't want to have competition from other cancer sites. So sometimes we end up with a situation that you remove that tumor and all of a sudden there's nobody controlling the other sites in the body that cancer might be at. So, okay, I took it out. I go back, we look at it, we x-ray it, we do everything, don't have a problem. And now all of a sudden something else creeps up. Or because of the treatments you were getting, the chemo, the radiation, everything else, your body's immune system was weakened. You end up in a situation where you're exposed to something. And the survival rate may not necessarily be caused because cancer caused the 16% of the people to die, but it reduced your overall ability. So if you catch a cancer at 55 years of age, you take it out and your normal lifespan, let's say to 78. So you have another 23 years of life. Uh, what if you caught that thing at age 71? Maybe it grew up to the size of a cantaloupe. Well, you remove it, and maybe now your lifespan is 76 or 5 years, whatever it may happen to be. So just because they say these things, the 71% might be 99% for a particular kind of cancer, and it might be 52% for another kind of cancer. These are generic averages. They don't apply to a specific one. But in talking about generically stage three, yeah, 1 out of 3 people will still be alive after 5 years. Now, they'll give you great numbers like 80% after 1 year, but you start doing some research and you say, well, that 80% dropped down to 42% at 3 years, dropped down to 27% at 5 years. So be careful what you're reading. And then taking care of yourself after that surgery is big time. Survival means, for many people, cancer free, treatment free, full remission. Some people have survival and they need to be in treatment and they live with the cancer because it's a treatable, manageable condition. So survival really means management with regard to if you're living with the cancer that is controllable. Chemotherapy, the ones we hear about a lot. These are drugs, chemotherapy drugs, and they're used to destroy the tumor. You get it in a number of different ways. We'll talk about that in just a second. But it's supposed to kill the cancer cells, fast growing cells, but sometimes we have healthy cells that are fast growing cells, our skin cells, our hair. There's other parts of the body within the intestines and stuff that are healthy cells. They're fast growing cells, but the target of the cancer killer drug is fast growing cells. When I put a chemo 5-fluorouracil, a chemo topical ointment I put on my skin periodically to attack precancerous conditions, fast growing cells in the skin. Well, it's going to attack those particular cancer cells, but not affect the other normal cells around it. So the purpose of the chemotherapy drug is to cure yourself of the cancer by reducing the cancer growth or killing the cells, whatever. Many times chemotherapy is used in conjunction with radiation. It can be used with other ones. So as we see today, there'll be a lot of other options we can consider. But they're typically administered orally, a pill, an IV, an injection. Intrathecal, I think that's in between the muscles. Trying to think back to what it was. Intraocular. Here all of a sudden, I can't remember. All these things I had memorized earlier, I don't know now. Intraperitoneal. There are several ways of being able to administer drugs, and I apologize right now for just having a temporary loss. Drugs can also be administered through a catheter, through a port, or for a pump. Immunotherapy, one of the newer kinds of treatment. Cancer cells interfere with the immune system. Our immune cells can see parasites, can see fungi, can see bacteria, can see viruses. They look different than normal cells. But normal cells, when they have mutations, sometimes look like normal cells, and the immune system can't see that disease. Well, if the genetic changes are on the surface, the immune system may be able to see that. But sometimes proteins that the cancer controls changes that immune response. In other words, it looks different, but I'm not going to attack it. And it just moves on to the next cell to look at it. So it's the cancer is actually the tumor's changing our immune response because it can. And so we need to be able to find a way to take our immune system and help it fight those tumors. And that's what's called immunotherapy. A lot of stuff out there right now, and it's just amazing amount of things. We have what they call immune checkpoint inhibitors. If there is a checkpoint in the body that the immune system will not go beyond, it's a checkpoint. Well, if the cancer is causing that to stop, maybe we can do something about it by going around that checkpoint. There's a T cell transfer theory. T cells are what kills the cancers. Our immune system sends out these T cells, and there's been some amazing results lately, particularly in laboratory animals with T cells. It's just unbelievable with regard to their ability to kill cancers. And that's one of the last topics I'll be talking about, not today, but next week. But the T cells actually have the ability to go out, and if properly taught where to go, will just destroy cancers. It's really good. But right now, we can take and isolate an individual T cell, create what it's its target, and say, okay, let's go out there and do that. With the pandemic, I had monoclonal antibodies, and when I got the virus, monoclonal antibodies are one of the immunotherapies that's out there. It can be used for cancer. It can be used for a lot of different diseases. But what we're doing is we're taking the immune response and we're targeting it at a specific aspect of the cancer cells. You know, not all cancer cells are equal. Not all cancers look the same, act the same. And when you're trying to target a pancreatic cancer or a lung cancer or a brain cancer, there has to be a different way of getting to there. There are things called treatment vaccines, oncological vaccines that are out there that they develop a particular vaccine that will attack in other words, we're setting it up. It looks like a cancer cell. We put it into our immune system. It goes and finds that cancer cell and attacks it just like it would any other disease that comes in the body. And then we also have things called immune system modulators that take and make our immune system, we shift it in such a way that they become more effective. Survival rates using immunotherapy, 80% when treated early. A lot of times it's even used in very late stage events. Many times it's combined with other. You may combine it with chemo. You may combine it with radiation. Big problem with immunotherapy is they maximize it for about 2 years. It's because when the cancer starts seeing the same thing over and over and over again, it has its own kind of immune response and kind of hides from it. Sometimes immunotherapy is used as a last resort when everything else fails. That's one of those things you can talk to your doctor about. Well, for this kind of cancer, when should we consider immunotherapy with regard to how effective the chemo is going to be? It's a topic for discussion. Again, used for advanced cancers, can be combined. A lot of side effects. So talk to your doctor about what are the side effects of that kind of immunotherapy. The chemo drugs are bad enough with side effects. Radiation can be bad enough with side effects. This is no different than either one of them. Every single kind of this treatment will have side effects. Some not so bad, some so good. But oncolytic viruses I talked about a minute ago, we actually design a virus that puts into your immune system, goes out and uses those T cells to target the cancer cells. This is one that I have really fallen in love with over the last several weeks. Back in the 1920s, Otto Warburg came up with the ability to tell cancer cells from healthy cells. He found that several things. They live in an oxygen-free environment. For most cases, they use fermentation rather than respiration. They use a higher acid environment to live in, usually about 0.5, 0.3, 0.7 pH. Lots of things that are unique. He won a 1931 Nobel Prize for that. And so early on, you had this metabolic disease that was it destroyed a lot of cancers. But unfortunately, it didn't destroy every cancer with the treatment. And the treatment was very simple. Just get rid of sugar in your diet. Early ketogenic kind of approach. Because if the cancer cells are using glucose as a fuel source, take away the fuel, it starves. And it worked. But not every cancer uses glucose as a fuel source. Some use it, some don't. Some use it in conjunction with something else. Well, that something else is called glutamine. Well, glucose is pretty easy to control. If you don't eat sugars and carbohydrates, your body can make it, but it's not something that's in overwhelming amounts, and it's a problem. But glutamine, our bodies actually make. and it's also in a lot of different foods that we eat. So it's kind of hard to say, I'm going to reduce everything in my body so I get rid of, yeah, it's not going to happen. However, sometimes you can address the glutamine issue with certain kinds of drugs. One of them is called DON, 6-diazo-5-oxo-L-norlucine. It's a drug that is used, it stops the metabolic use of cancer tumor cells to use that glutamine. There are other things. Berberine is a natural one. I think there's a couple others in here I mentioned that. Green tea I know is one. There's some other ones in there too that they disrupt that normal process by which the cancer uses its fuel. So if you can shut down both glucose and glutamine, that's a metabolic response. You're not hitting the body with dangerous chemo drugs. You're not using radiation. You're not using all these other things that can be more can do more damage to the body. Now, unfortunately, because standard of care in the United States, we can't just automatically go do this. And so you're looking at things. I would suggest you go onto YouTube, type in Professor Thomas Siegfried, Dr. Siegfried, and he talks about the fact that, yeah, they're looking at glutamine drugs, but the FDA trials will not use glutamine drugs with a keto diet. They said, we have to make sure that the glutamine drug works. Well, that's part of the problem that Otto Warburg had, is it worked on the glucose, but it didn't work on glutamine. And years later, we found out about the glutamine. That would have been nice to know at the very beginning. And so the FDA trials were only looking at the drugs. They don't look at diet. A diet is not something that FDA will do. So if you were able to structure clinical trials with a diet and these drugs, you would probably find some very significant success stories. As I'm looking at them, and I'm talking about some major ones, people had stage 4, this, that, whatever. They show up over in Cairo or someplace, they get through this whole process, and it's like a 96% survival rate for stage 4 pancreatic cancer, whereas in the United States, it's like 4% after 5 years. But the ones they use, the metabolic response, the body's already been wasted so much with chemo and radiation that it just doesn't have the ability to withstand the additional treatment. However, one size doesn't fit all. You just can't, you can shut down your body's glucose with the ketogenic diet. That's good. I don't think anybody has a problem. You can do intermittent fasting, where now you allow more opportunity in the body to take that fuel away from the chemo. But in reality, if you're working with, say, Dr. Siegfried, they want to look at what other issues, do you have pancreas, do you have diabetes, do you have other diseases, how much do you weigh, what is your exercise level, what are the foods they actually tailor a particular plan to your specific needs with regard to this metabolic response. And many times it's less than a month. It's amazing in what it can do. The ketogenic diet, combine it with an intermittent fasting, and now you're getting almost an exponential result. I mentioned berberine earlier. Be careful with that. It will disrupt the glutamine reaction, but there's some side effects there and some dosage areas you need to be aware of. Green tea I talked about, bell peppers, whether they're green, red, yellow, doesn't matter. They all have an effect on the ability of a tumor cell to use that glutamine. And when you're starting to do research on metabolic disease, it's very hard to get Google to tell you about it. Even when you type in everything, all of a sudden articles start coming up with metabolic syndrome, which is not the same thing, but it's one of those ones that if you're not paying attention, you can go down the wrong path. I would recommend on this particular one with metabolic disease, go to YouTube. You're going to find a lot more valuable information, user-friendly information on YouTube than you will on Google. There's a thing called biomarker testing and treatment. Every tumor has certain kinds of genes, certain kinds of proteins, certain other markers in that says this is unique to the cell. And as such, we have ways of looking at that thing, genetic, epigenetically, and these other ones, proteomic, glycomic. And we have imaging markers that when a target goes out there, when let's say, call it a hunter killer, you have this drug, or you have this thing that's going out there and it's looking for something. Oh, there it is. Okay, I know. And it can home in right on that particular cell because it has markers that says, hey, I'm a cancer cell. Come over here if you want to talk to me. But these things, we know PSA, we heard about prostate specific antigen for prostate cancer. You have another one, PAP, prostatic acid phosphatase, for ovarian cancer, CA125, for carcinogenic embryonic antigen, CEA, and other ones, AFP, alpha fetoprotein, HCG, human chorionic gonadotropin, CA19-9, prostate cancer, CA15-3, bone cancer, and there's a lot of them. If you just start looking at, you'll find over 24 of them, and they all are uniquely identified to a particular kind of cancer. So if you're looking for a way to diagnose, well, if you can diagnose and you see the biomarker for that one, maybe there's a drug out there that's already isolated that works well with CA19-9 because it's already been pre-programmed to go right straight to that particular marker and do its damage. Biomarker testing, you're using the molecular structure or surface of the cancer molecule, and you're providing the hunter killer cells that are going in there the ability to go in and stop it, to slow it down, to destroy it. And it's also used to say, well, how effective is this particular drug that we're using? So sometimes they'll take a look at the biomarkers and say, well, it's been reduced 50% or it's down to 10%. And sometimes you hear that from the doctors. Well, they looked on the MRI or they looked on whatever kind of instrument. Well, sometimes the instrument is this biomarker testing. They see that it's much less than there. But you still have problems with sensitivity of the test, and sometimes there's some false positives. So you need not just a single reading, you need more than a couple. Again, when you use this as a treatment option for certain kinds of cancers, it's higher than 50. For other ones, it's less than 50. Hormone therapy. As with any kind of organism that's growing, hormones are needed as part of the process in that. So if you can develop a therapy that can stop or slow down the hormonal action inside the tumor, and they have those, there are hormones out there that they know work very well with certain kinds of organs. So they give it to you, it goes in there, it blocks or interferes with that particular hormone's response within the cancer cell. And that is very, very effective. It can be done a pill, it can be done an injection. Sometimes it's used in surgery that it's shrinking the tumor and making it more easily available for surgery. Survival rate for most of them is 80%. So it's a really good treatment. But again, not everything you're going to find a hormone in, bone cancer, for instance. But anyway, something to talk to your doctor about. This is an interesting one that I thought. Hyperthermia. Well, you're going to treat tumors with heat. And the heat goes in and destroys and kills the tumors. However, heat does not destroy or kill normal cells. But you need to be able to have that heat isolated. So they give you a injection that likes to sit in cancer cells, but not necessarily coagulate and stay around the healthy slope. So when they now put it with the heat or laser, whatever kind of light they're using, the tumor cells will start to decay, destroy themselves at 113 degrees, whereas the healthy cells don't have these targeted attachments to it to say, this is where that heat needs to go and stay. So anyway, something very interesting. I found that, again, and right now, depending on how early you catch something, survival rate for a lot of different kinds is 50%. Biggest problem is they're not using it with every single kind of cancer, and the sample sizes that they're using are not good enough to say, this is, for this kind of cancer, it's 80%. For this kind of cancer, it's 32%. But over time, it's going to be one of those ones I think is going to be very, very effective. I know for some of my precancerous treatments, I have an option of using a blue heat lamp with something on my face to kill those precancers that I use the 5-fluorouracil chemo drug. I haven't opted for it yet, but it's something I'm thinking about. There's a photodynamic theory. Now you're using drugs combined with light therapy, and it may be a LED, it might be a laser, but you're finding that cancers and precancers can be treated. And again, this is on skin cancers. really a good way of going it. The tumor absorbs a particular, they call it photosensitizing agent. It goes in there, attaches to the chemo cells. The other cells lose that photosensitizing agent more quickly, generally 1 to 3 days. The healthy cells, that stuff is gone, but the cancer cells hang on to it for a longer. You turn the light on, you zap the area, and that's where you limit the damage to healthy cells, but kill the cancer cells. 5-year survival rate for most cancers around 60%. And we're right at radiation, which is slide 17, and I think we're going to call it quits there. So let me get all the way down. Let me just tell you, red.olaughlin.com. We're going to be back next week, hopefully wrap everything up with session number 8. We're going to finish the treatment options, talk a little bit about prevention, and conclude hopefully our session on cancer options, treatment, etc. I can be found at red.olaughlin.com. I have several books out there. My last book is on Alzheimer causes and options. It's available on Amazon. It's available on my website, red.olaughlin.com. That's RED, like the color red. O'Laughlin, OLAUGHLIN.com. And I look forward to having you all join me next week, or catch me on the reviews on YouTube with the archive, and we'll go from there. So thank you again for joining me today on Talking Heads on the USA Global TV and Radio Network. Bye now. Well, I still have this show. Let me see if I can get down to the slide with my books on it here without too much difficulty. There we go. No matter what you can do, it talks about the subconscious brain, how you can talk to what controls 95% of what you do. My Joy of Ageless Health talks about the primary causes of aging, disease, stress, toxins, radioactivity, infection, inflammation, diet, and more, and what you can do about it. Longevity Secrets for Healthy Aging talks about the 2 primary causes of aging, telomere length and telomere length is one, and the human growth hormone is the other one. And there are things you can do to accelerate the aging process, and the things you can do to slow it down. And my last book, Understanding the Causes of Alzheimer's, is a compilation of over 40 articles I've written over the last several years on things that people with Alzheimer's really should know about, because there's just a lot of stuff going on out there that people don't know. So we'll try one more time and see if our producer is ready to end the show. If not, I will stay here patiently until we'll keep talking.